Good morning. This short video is to demonstrate the insertion of the Morgan lens for eye irrigation in the emergency department. The Morgan lens is the gold standard for flushing foreign bodies and particles, irritants, airbag injuries, flash burns and chemical or blood-borne accidents. It's a sterile cupped delivery system used to irrigate with saline. It's very simple to use with minimal training and can be used from the age of 6 months upwards. It can also be used without anaesthetic if the patient has allergies to local anaesthetics. The main rule that must be remembered is not to allow the giving set to run dry of fluid prior to the removal of the lens. Don't waste time with chemicals injuries, these are urgent. The process that you are about to see is as follows. Set up the giving set with a litre of normal saline 0.9%. Explain to the patient the method of insertion that you're going to use and gain their consent. Install the anaesthetic into the appropriate eye and set up the fluid collection system. Find a way that works for you or change the patient into a gown. Explain what you're about to do and the steps you're going to take. These are mainly look down, look up, it's in. Start the flow of saline and watch for the rising bubble. Tell the patient to relax with their eyes open or closed. Open the flow of the giving set completely. A litre will take approximately 20 minutes to run through completely. Keep a check on the bag and don't let it run dry, but you can leave your patient during the process. Removal is simply the reverse of insertion. After 10 minutes of removal, check the pH again and review the eye patient in the normal way using the slit lamp. Thank you.
Okay, so we have the patient ready on the bed, laying down with a change into a gown so they don't get soaking wet if this goes wrong. And there, and some protective covering on the top of the bed. So we prepared the saline in the bag, run through a giving set, just a normal giving set. And then we have also ready here the Morgan lens, which is like a large contact lens with a hole in the middle, which is going to attach to the irrigation. A bag, which we'll show you how to set up in a minute. And a bowl to collect the drainage. So, check that the saline, this is just normal saline, we'll check that's in date. We normally use a litre of saline, sometimes 2 litres, sometimes more depending on the contaminant that we're washing out. Before we do any of this, we check the pH of the patient's eye, comparing it to the other eye with the special pH tape. And then before an irrigation, and it's also checked again 15 minutes after the irrigation finishes. To make it more comfortable for the patient, we put some local anaesthetic in the eye. We tend to use proximethicane 0.5%. It's kept in the eye cupboard or usually in the fridge. And 1 or 2 drops of this should be enough. So, if I ask you to look up for me, I'm going to drop that in there. 1 drop in. Look up again. Okay. So to collect the fluid, I'm going to adjust just a normal blood sample bag. If we cut a hole in the bottom, or just cut the bottom off, it's just equally as good. Remove the piece of paper. And this piece of paper. Okay, so take the Morgan lens out of its pocket. This is the Morgan lens. That's going to attach to the end of this. I'm just going to thread it through the bag before I run some more fluid through it, so it needs to come in from the bottom. Okay, so we put the Morgan lens through the plastic blood bag. Just going to make sure that the fluid has run all the way through to the cup. Okay. So, if I just attach the bag to the patient, so you can use this bit of sticky tape, take that off there. We need to stick it along the lateral side of the eye because it's going to drain fluid back into the collecting bucket. Let me stick that there. It can be useful to just put a little bit of extra tape just here. Okay. Make sure that's in the drainage area. Okay, so let's just fill this again. Make sure this is full of fluid before you put it into the patient's eye.
So the insertion technique is as follows. Get the patient to look down and the Morgan lens will go under the upper eyelid. As they then look up, it tends to slip into place. And that will just sit there like that until removal.
Then you're going to ask the patient to look down. And then you pull up that upper lid. You put the lens here. And then pull the lower lid down, look up. It's in the patient's eye. Is that okay? Absolutely fine. And then you split the fluid on. If you've put the bucket correctly in the bag correctly, the fluid as it comes out of the patient's eye will run through this bag and into the collecting area. Never let the cup run dry, so make sure it takes about 20 minutes for a litre to go through. So come back before the end and make sure that the eye never runs dry. Are you okay?
Yeah, fine, thank you.
So then when we come to take it out when it's finished. We'll just make sure it's finished. Take the plastic away gently. Okay. So if I ask you to look up, I'll just flick it out here. And out. There's a towel here somewhere.
Thank you.
Okay, so we're just going to test the pH of the patient's eye using the pH strip paper that's available in the A&E department. Normal pH of an eye is 7 to 7.3, but here we can only go in whole numbers, so if you look at the 7. Tear off a piece of the paper. We'd be doing this before washing out normally of any kind of chemical, and again 15 minutes after, just to check the pH has returned to normal if there was any abnormality. So if you ask the patient to look up, let's pull the lower lid down, pop it there. Close your eye just for a moment. Just open. Should have a little bit of the eye fluid on the paper, which you can compare against the colour chart here, and it's 7. You'd repeat the procedure in the patient's eye that has not been affected and just compare as well with the patient's normal pH in the eye.
Just as an extra note with that, you don't need to pH with irritants, only mainly with chemicals. So it doesn't matter if you don't do it with kids with detergents and things like that.